Hey, I'm Dr. Gardner, and tonight I wanted to talk about right-sided heart disease in dogs, and this is a special video for Gus and his mom, so I hope you guys like it. So to talk about right-sided heart disease, first I'm going to talk about how blood moves through the heart. So the blood that has already been used, that the body has taken all the oxygen from, returns to the right side of the heart. So it comes to the right atrium, then it goes to the right ventricle. The right ventricle pumps it to the lungs where it can go and receive more oxygen for the rest of the body. So it picks up that oxygen and then it goes back to the left side of the heart. It goes to the left atrium, then it goes to the left ventricle. The left ventricle then pumps it out to the whole body where the body receives that oxygen. So if you have right-sided heart disease, the symptoms that come along with that make sense given the way that the blood flows through the heart. So if you have right-sided heart disease, then that can lead to a backup. So if the heart is not receiving or pumping blood properly, then blood can go where it shouldn't, which is in the wrong direction. And so typically what will happen is pressure will build up in those vessels that are trying to return blood to the right side of the heart. And as a result, to deal with that, the body will try and get rid of some of the fluid. So that fluid will literally leak out, and then you'll get fluid in your abdomen or potentially in the legs as well. If it's in the abdomen, which is most common with right-sided heart disease, that's called ascites. So what can cause right-sided heart disease? There's a couple of things. One of the things that can cause right-sided heart disease is actually left-sided heart disease. And if you're interested in learning more about that, you can check out my videos on dilated cardiomyopathy and also on mitral valve disease, which is two very common causes of left-sided heart disease. Other reasons are pulmonary hypertension, and that's usually caused by heartworm disease, unfortunately. And then it can also be caused by pericardial disease, so there can be fluid buildup or problems with the pericardium, which surrounds the heart. There can also be things like congenital disease, cardiomyopathy, or heart muscle disease, or things like tumors, and there's also tricuspid valve disease. So on the left side of the heart, you have the mitral valve, which is between the left atrium and the left ventricle. And on the right side, you have the tricuspid valve, which is between the right atrium and the right ventricle. So if you have a problem with that tricuspid valve, it can allow backflow, and that can cause right-sided heart disease. So what are some of the symptoms we see? We already talked about one, and that's the big one that can differentiate right-sided from left-sided, and that's ascites, which is the buildup of fluid in the abdomen. But the other signs are very similar to left-sided heart disease. So you can see lethargy, coughing, a change in appetite, difficulty breathing. You can also see jugular vein distension. This is diagnosed in a similar fashion to left-sided heart disease. And of course, sometimes we don't know it all, and our dog starts showing really terrible symptoms, and you end up in the emergency room where they tell you that your dog has heart disease. So sometimes it's very occult, you don't know that it's going on, but other times there are some symptoms, and we can move forward with diagnostics. Those include chest x-rays, a pro-BNP blood test, a routine blood test of a CBC and chemistry to help rule out any concurrent diseases that could be contributing, like heartworm disease. And then also do a blood pressure, and of course the gold standard is an echocardiogram with a cardiologist. So you would take all of those things into consideration, and then we go in for treatment. So treatment is also similar because you still have the same goal of trying to strengthen the contraction of the heart. So pimobendan is top of the list, but we'll also use sometimes sildenafil, which is Viagra, and that increases the relaxation and the widening of the pulmonary arteries, and then the heart doesn't have to work as hard. So that's oftentimes used. We'll also use ACE inhibitors and furosemide or Lasix to help deal with the fluid buildup. And there are some other medications that can be employed as well, depending on what's seen on the echocardiogram. So one of the things I do want to point out is that a very common comorbidity with heart disease in dogs is renal disease. So that's something you would definitely want to check out, because that can make changes and adjustments to how you would want to treat. And of course, there are some natural things that you would want to consider and incorporate. Of course, whole foods diet, I always think that's the best. Omega-3 fatty acids, really great for inflammation. I think everyone should be on them. And then Hawthorn and Dandelion are great and very supportive. Coenzyme Q10 and vitamin E. So those are the things that I would consider if your dog is diagnosed with heart disease, and if you can address it early. A lot of times the prognosis isn't too bad. It is a disease that we can't cure, we can only manage. Sometimes we can make some positive changes if we catch it early enough, But remember, there are some dogs that don't have early enough signs for you to tell. So if you have had a dog that has had heart disease, I would love to hear from you and what your experience was. If you have any questions or comments, please let me know. I hope you will like and subscribe, and I hope you are planting your garden. I am looking forward to doing that with you, and I will see you next time. Also, Poppy wanted to make a very brief appearance.